Good morning, everyone. It's a true honor, a privilege to be given the opportunity to welcome everyone to the great city of Reading. Please know that everyone that is here visiting, the doors are always open to you. Please know that we are grateful that this event and this press conference is being held in the fifth most populous city in the Commonwealth, being Reading. God knows that many in our community have been skeptical about getting the vaccination. So this is very important to me and to our community. The fact that we have created these partners, which I'd like to thank the Department of Aging, Secretary Torres, Secretary Bean from the Department of Health, of course, the governor's office, and institutions that are going to be administering the thousands of vaccinations that have been available to us, made available, such as Penn State, St. Joseph, and Tower Health. I said recently that I would not stop, I would not rest, making sure that as many individuals as would like to get vaccinated could have that opportunity. And we have seen that come to fruition as of recently. And it's all because of our great governor and the Department of Health willingness to make sure that we are not forgotten. So I am truly grateful to be given the opportunity to introduce our great governor, Governor Tom Wolf, to the stage. Thank you, Governor.
So thank you very much, Mayor, and it's great to be in Reading, and thank you for welcoming us all here, and thank you to all these great public servants surrounding me here. It's great to have you here. And I want to thank everybody for joining me today, joining all of us today. This is an important thing that we're doing, trying to get vaccines out, making sure that we're doing this. And I just want to brag a little bit about Pennsylvania. As of this morning, we are number 10 in the country in terms of first doses in arms at 47.3%. The national average is only 42%. Again, Pennsylvania is way above average on second doses. The national average is 29%. We're at 30%, so we're above average there. And in total doses, 79% is the national average. We're at 81%. And Becker has us at 23rd. So we are way ahead of the national average. And again, in every part of the Commonwealth, our goal is to get as many people vaccinated as we possibly can. By the way, I waited in line. We opened up Pennsylvania 2 weeks ago, and so I made my appointment and I got my first dose vaccine last week in York, Pennsylvania. So thank you. Yes, I'm on my way. My second dose will be on May 17th. It was Moderna, but we need to get everybody vaccinated. And that is important because as we get more people vaccinated, obviously that helps the person who's getting vaccinated, but it helps everybody else too. It helps get us closer to that herd immunity when we can all get back to life as normally as we possibly can. So the problem is that you know, when we first started this, the problem was supply. There just wasn't enough. Now we're at the point where supply is coming close. We're not quite there yet, but it's close to demand, and we actually are starting to see some openings and vacancies when we and open appointments. So we need to go out affirmatively, reach out to people, and make sure that people who are having a tough time getting to a place where they can get the vaccine, that we do what we need to do to get that vaccine into that arm. So we are really working hard and partnering with community partners, the Departments of Aging, the Departments of Health, Human Services, their community partners. This is just one example of collaboration after another to ensure that Pennsylvanians who cannot get to a vaccination site easily, that we get the vaccine to them. There are Pennsylvanians who can't leave their homes. They face unique challenges when it comes to vaccine access. We need to make sure that we do everything we can to reach out to them. It's very important to me and to everyone here that we do this and we make this concerted effort to reach the group of Pennsylvanians who have a hard time getting to places where the vaccines are. These are people who have been particularly hard hit by the pandemic because they've suffered the same isolation that we have, and even more so than we all have as a result of this pandemic. So we are committed to finding every way we can to reach Pennsylvanians who cannot leave their homes and give them equitable access to the COVID-19 vaccine. We're working across agencies again, and we're working across community organizations. For example, we've had great success, and you'll hear a little bit more on the areas agencies on aging. We've had some great success working with them to make sure that we get out to all kinds of people who have a tough time getting to vaccines. The Secretary of Health recently amended her order to vaccine providers to ensure that providers are working with groups like this, doing outreach to Pennsylvanians who cannot leave their homes. The Department of Aging and the area agencies on aging, again, are reaching out. And the Department of Human Services providing assistance to Pennsylvanians with disabilities who can't leave their homes. We're also working with housing associations. We're working with nursing care organizations and our federally qualified health organizations and centers and other community partners to make sure that we are doing every possible thing we can to reach out to Pennsylvanians, to identify them, figure out where they live, and how we can get the vaccine to where they are. So if you or someone you care about can't leave home and they want to get a vaccine, please reach out to the Department of Health or the local area agency on aging, or the Department of Human Services for help. All of us can help in trying to make sure that these folks get the vaccine that we need them to get. Again, I want to thank everybody who is working hard to connect Pennsylvanians in need with this vaccine. This is really important work. It protects the folks who are getting the vaccine, but it protects all of us. The dedication of these organizations saves lives throughout Pennsylvania, and that is important. We need to ensure that no Pennsylvanians are left behind in this effort to get vaccines. So thank you, and now I'm going to turn this over to the Secretary of Aging, Secretary Robert Torres. Secretary Torres.
Thank you, Governor. Good morning. It's a pleasure to join the Governor, my colleagues, our hosts, and local leaders here in Berks County to talk about the ongoing work to help older adults receive their COVID-19 vaccination. The Department of Aging is committed to helping all segments of Pennsylvania's older adult population obtain a COVID-19 vaccine. This includes older adults who are unable to leave their home, such as those that need help of another person or would need to rely on medical equipment to leave their homes, or whose health could get worse, making a trip for the vaccine either impossible or impractical. Vaccinating seniors unable to leave their home is an issue that we have focused on within a subcommittee on aging, which I have been leading for the past 2 months. And it is an issue that requires us to mobilize and collaborate to fit the needs and the resources of each community. The area agencies on aging have been doing an excellent job collaborating with community partners to help older adults obtain their vaccine appointments. Now we're seeing these agencies and counties build upon successful models to find creative ways to reach seniors who are unable to leave their homes, such as partnering with emergency medical technicians and visiting nurses. We appreciate the ongoing support of the Governor and the Department of Health to help us further advance these efforts. On March 25th, when the Department of Health issued an amended order indicating that vaccine providers must work with local area agencies on aging to schedule appointments for older adults, we started seeing positive results right away. Area agencies on aging were able to work with dedicated vaccine providers to offer direct appointment assistance to callers and clear their waiting lists. Today's newly amended order further supports area agencies on aging to serve older adults who are at home or who may feel discouraged or hesitant about getting a vaccine. Area agencies on aging have been working hard to reach seniors unable to leave their homes in a variety of ways. For example, Butler County and Indiana County are working with their local health systems and Visiting Nurses Association to offer the vaccine. Delaware County has been working with their county vaccine operations and using 3 teams of EMTs to provide vaccinations. Pike County has implemented a strategy with the county's emergency management agency and volunteer drivers who deliver meals. They have compiled the names of seniors most in need, and EMTs are going door to door to vaccinate them. And last Friday, the Philadelphia Corporation for Aging which is the Area Agency on Aging in Philadelphia, together with our PACE Pharmaceutical Benefit Program, announced the launch of a hotline to serve the city's older adults who still need help getting their vaccine. We're committed to reaching each and every senior who wants a vaccine. We encourage all seniors and their caregivers who want vaccine but have had difficulty or are unable to leave their home to please contact their local Area Agency on Aging directly. Please do not give up and let us help you, as getting older adults vaccinated is still much a priority focus for us. I want to thank Berks County for hosting us and for the excellent collaborative work you have been doing to reach the most vulnerable members of your community. I was especially impressed with the vaccine clinic supported by the Daniel Torres Hispanic Center, Tower Health, the Berks County Area Agency on Aging, and the Reading Housing Authority. This clinic targeted 400 appointments and ended up providing just shy of 1,200 doses, which was the most successful clinic up to that point in early March. I also want to thank all the area agencies on aging, vaccine providers, and county governments for their continued hard work and support to get this job done. It is sincerely appreciated. Now it's my pleasure to introduce the Acting Secretary of Human Services, Meg Snead.
Good morning, and thank you all for having me today. My name is Meg Snead, and I'm honored to serve as the Acting Secretary of the Pennsylvania Department of Human Services. I'm especially pleased to be here today as we discuss the efforts the Commonwealth is taking to ensure that some of our most vulnerable residents, seniors and people with disabilities who cannot leave their homes, have the opportunity to get a COVID-19 vaccine. The Department of Human Services administers Pennsylvania's Medical Assistance Program, which helps more than 3 million Pennsylvanians access health care, many of whom are at a greater risk in this pandemic because of their age or other co-occurring conditions. Vaccinating Pennsylvania's seniors and people with pre-existing health conditions is the best way to protect people who are at the highest risk for severe illness from COVID-19. But we know that some individuals may need extra help finding a vaccine provider or need extra assistance in order to safely access their vaccine. In our medical assistance program, managed care organizations, or MCOs, coordinate delivery of care and other supportive services for people covered by Medicaid. In Pennsylvania, we have MCOs that cover physical health care, behavioral health care, and long-term services and supports for seniors and adults with physical disabilities, or what we call our Community Health Choices program. We know that there are about 3,300 people statewide enrolled in Community Health Choices who essentially cannot leave their homes, according to assessment information provided by the CHC MCOs. This means that these individuals have no ability to walk using an assistive device, a wheelchair or scooter, or they may require a ventilator or have other serious medical limitations that make them higher risk if they're exposed to COVID-19. Last month, Acting Secretary Beam issued an order directing our Physical Health and Community Health Choices MCOs to connect our high-risk MA population to vaccine providers to assist with appointment scheduling. Today's amendment to this order directs vaccine providers to work with MCOs and the area agencies on aging to facilitate scheduling for individuals who cannot leave their homes. We cannot leave anyone behind in this vaccination process, especially those who aren't able to leave their homes, even with assistance. So we're working hard to address these barriers in this process. In order to help with the cost barriers providers face in vaccinating this population, DHS is working with the Federal Centers for Medicare and Medicaid Services, or CMS, to increase the Medicaid reimbursement rate for vaccine providers that administer vaccine in-home. Our vaccine providers and MCOs have been great partners in DHS's vaccination efforts, and together we're helping get these life-saving vaccines out where they're needed most. We also know that medical assistance primarily covers people in lower income communities, as well as many of Pennsylvania's seniors, and disproportionately covers communities of color who we know have been particularly challenged by this pandemic. Our MCOs are working with their enrollees now to ensure that all Pennsylvanians who want a vaccine are able to find a provider and get an appointment. As we strive for an equitable vaccination process, this collaborative work and these partnerships are essential. This work will save lives. I want to thank everyone who's here with me today for the work you've done to help these communities through this tumultuous last year. I look forward to working with each and every one of you in the coming months to ensure that we're doing all we can to get the COVID-19 vaccine to the people who need it most and are helping Pennsylvania overcome this pandemic. And it is my pleasure to introduce Senator Judy Schwenk.
Thank you, Secretary Sneed. Good morning, everyone. Good to see all of you here. You know, so often when we think of homebound people as being shut-ins, we think of senior citizens, but it's just not that, right? There are many individuals, as Secretary Sneed told us about, that literally cannot get out of their homes no matter what their age is, or they're not even able to get outside to visit with other members of their community. I've met many homebound folks throughout my tenure as a state senator. They're wonderful people. They're people just like us that want to get out and socialize. Think about what they have gone through during this pandemic. It's made a lot of things difficult for us, but think about how it's been for them. For our homebound population, it was already an effort to get food, household necessities, and access medical care. And add on top of that social isolation, and think about how they have suffered, and the fear of catching what could be a deadly virus, and you can only imagine what the last year has been like for them. We need to include this population in our vaccination plans, and I'm glad to see our governor, Governor Wolf, and Acting Secretary of Health Beam, our Secretary of Aging, as well as our new Secretary of Human Services, all taking this issue so seriously. I'm also grateful for the providers who are doing the legwork, and I'm going to give a shout out to the people on my left. They're the boots on the ground who have literally been making the phone calls and making sure that they are getting to the people that need this vaccination. I can look at you and say, thank you. Thank you so much. You're a beacon of light for many of our homebound individuals, and I'm sure you'll hear a lot of thank yous over the next few weeks. So I wanted to be sure to add mine. You know, every day we're making progress against this deadly virus, whether it was reaching our seniors first, then reaching our homebound individuals and so many others, our frontline workers. Every day, thanks to the efforts of a lot of the people behind me, we're making progress in getting through this situation. And so now, I guess I would add that for those of you who haven't yet had your vaccination, and now you have the opportunity, what are you waiting for? Let's get this done. Let's see this not necessarily just because it's something that we should do, but something that we want to do for all of us. And that's providing the gift of good health to the entire population. So if you haven't had it done, let's get it done. Thank you. And I am happy to introduce our new state representative for this district right here, Representative Manny Guzman.
Hey y'all, good morning. Welcome to the city of Reading. Thank you very much, Governor, for showing up. Thank you to Secretary Torres and to Acting Secretary Sneed. As I said to you, Governor, when you first walked in, the doors are always open here for you in the city of Reading. This is such an important topic, and I can't tell you the countless times, the countless phone calls that I've received in my office in the very short time that I've been the state representative here in the city of Reading. I can probably say on a very good day, we've probably gotten anywhere between 10 to 20 calls daily from individuals within our community asking about access to the COVID-19 vaccine. For those individuals who are homebound, there wasn't much I can give them. because at the time, it wasn't an at-risk population that the state was focused on. Even though it was on their radar, it wasn't on their focus just yet. Today, I'm proud to say that those homebound individuals now have an option, now have the ability to get that COVID-19 vaccine. And I want to do whatever I can. My office will be that resource. So if there's any individuals watching at home right now who are homebound, who want access to the COVID-19 vaccine, who don't want to figure out how to who their acting aging department is here in the city of Reading, you can call my office. You can call my office at 610-376-1529, and I'll be more than happy to connect you with those individual organizations who are administering these vaccines to you, your friends, and your family. As Senator Schwenk said, we still have a lot of work to do, but now, finally, the city of Reading has had his fair share of vaccines. And so now I'm calling on you, the community of the city of Reading. Mi gente latina, necesitamos que tú vayas a buscar tu vacuna de COVID-19. Now is your time to get your COVID-19 vaccine. There's no more time to wait. Now is the time to do it. I just got my second shot on Saturday, Governor. I can tell you that my arm's feeling a little weak today. But that's okay. I'm alive. And that's one of the things that I want all of my community to be, alive and well. We can get through this, and we will get through this together. But all of us, todos nosotros necesitamos hacer nuestra parte. We all need to do our part. So thank you very much for the opportunity to be here. I want to be a resource. I want to continue to be that bridge between you and state government. And if there's anything that my office can do to be that help, please feel free to reach out. Next, I'd like to introduce our Commissioner, Kevin Barnhart.
Good morning, and I too would like to welcome the Governor's Cabinet to Reading and Berks County, and a special compliment to our Area Agency on Aging, led by Jessica Jones, have taken well over 1,000 calls from people who needed the vaccine and found the right place. This is still a very powerful force. The variant's out there. We're still losing 700 people a day in the United States. Very serious. We still need to do our part to stop the spread and get our vaccine. This has really impacted the aging community, those who are shut in and others. Mental health and developmental disabilities has struggled. And the Council on Chemical Abuse has seen an uptick in overdose deaths. This is not just about COVID-19, it's about its impact on our community. So let's all pull together and get through this. I am pleased to announce on behalf of my colleagues, Commissioner Christian Leinbach and Commissioner Michael Rivera, we are on the precipice of opening our vaccine center at the North Reading Plaza in Muhlenberg Township. It will open Monday, May 3rd, this coming Monday, and will be open from 9 to 2, at least the first week, Monday through Friday. Vaccines will be given by appointment. Residents will be able to sign up for appointments for the week of May 3rd at www.doyourpartberks.com/vaccine center, starting Tuesday, April 27th. Appointment blocks for the following week will be added on Tuesdays moving forward. We have the capacity now. We will eventually ramp up to 1,600 vaccines a day. The Berks Cares Vaccine Center is a public health collaborative with the Berks County Health Center, Community Health Center, and other community partners to set up a community vaccine center that all residents can access the vaccine. The Community Health Center is providing the vaccine and will manage the staff at the site. Other community partners, Coe County Wellness Services, BARDA, Berks County Public Libraries, the Berks County Area Agency on Aging, and the Berks County Department of Emergency Services. Appointments can be scheduled through the phone number 1-888-712-2772, Monday through Friday from 9 to 5. Call center is managed by Coe County Wellness Services, is staffed to assist callers in English and Spanish, and has access to a translation line for other languages. The call center will assist residents in need of free transportation to the vaccine appointments through BARDA. BARDA's bus routes number 1 and number 3, which goes out 5th Street Highway and Kutztown Road to the North Reading Plaza, will be free to all riders starting Monday, May 3rd. Residents can sign up for email updates or find other COVID-19 opportunities in Berks County, www.doyourpartberks.com. And the county will host a media tour of the Berks County Vaccine Center on Wednesday, April 28th at 10:30 a.m. Media representatives interested in attending should contact Stephanie Weaver. This may sound a little slow in opening, but we now have the volume. We'll be able to receive at least 10,000 vaccines a week through the Community Health Center, and we have at least through August. And with the idea of potentially needing booster shots, we certainly will keep this open as far as time will permit, probably till the end of the year, if boosters are made available and necessary. So again, we want to thank our community partners, Cook County Wellness, the Community Health Center, the Berks County Public Libraries, and the Agency on Aging for teaming up to make this happen for everyone in Berks County. So again, as everyone else said, I'm getting my second shot on April 29th. Don't do it for yourself, do it for others as well. Let's get back to normal as soon as possible. Thank you and God bless you. And it's my privilege to introduce Rebecca May Cole, the Executive Director of the Pennsylvania Association of Area Agency on Aging.
Thank you, Commissioner Barnhart. And thank you also, Mayor and Commissioner, and all of you for inviting us to your lovely city today. It is a bit brisk, not what I expected, but I'll still say it's a beautiful city, and I'm privileged to be here today. As the Commissioner said, my name is Rebecca May Cole, and I have the privilege of working for Pennsylvania's Area Agencies on Aging as their Association Executive Director. Pennsylvania's 52 Area Agencies on Aging, we also call them AAAs, have worked to provide assistance to older adults for more than 40 years. This past year has been the most challenging due to the COVID-19 pandemic, and unfortunately, as others have said, our older neighbors, relatives, and friends have been hardest hit. The Area Agency on Aging Network has done their best to ensure that critical services continued and that the most vulnerable seniors have support. AAAs have made thousands of wellness calls to isolated older adults, provided drive-through pickup meals and delivered meals to individuals' homes. They pivoted to remote assessments and protective services investigations, following guidance from the Department of Aging, and worked to protect their staff with personal protective equipment when circumstances necessitated an in-person contact. As we've learned more about COVID-19, AAAs have made needed changes very quickly. Now that the vaccine is available, they have tirelessly worked to assist seniors by providing information and support to older adults. Many AAAs have had to temporarily restructure their entire operations in order to support older adults during this time. We appreciate the Governor, the Department of Health, and especially the Department of Aging's leadership throughout this entire process. Acting Secretary Beam's order from late March requiring closer collaboration between vaccine providers and AAAs has made an enormous difference in the AAAs being able to assist older Pennsylvanians in accessing vaccine. Hundreds of vaccine clinics were held across the Commonwealth, with entire clinics, doses, or time slots dedicated to older adults and their caregivers. Now the AAAs have shifted their focus to assisting homebound older adults in getting vaccine, which is especially challenging. The assistance provided by AAAs will look different in each area, depending on the resources available, the need, and the community relationships unique to their local service areas. No one knows the local community better than AAAs when it comes to the needs of older Pennsylvanians. So I want to take a moment to thank every one of the 52 Area Agencies on Aging for their tireless efforts to support and protect older adults throughout this Commonwealth. And like others, I also want to recognize all of you who are here today. It is an honor to be able to serve, to help you do the work that you do in meeting the needs of older Pennsylvanians. We appreciate all of the support for older adults demonstrated by everyone here today and look forward to even more collaboration for protecting their health and in caring for our mothers, fathers, grandparents, neighbors, friends, and other loved ones who at one time cared for us. For as Sir Isaac Newton said, we stand on the shoulders of those who came before us. Thank you. And now it is my honor and privilege to turn it over to Governor Wolf.
I'm happy to take any questions. Yes.
Yes. There's been some concern nationally about people who are getting their first dose but then skipping out on their second dose. Are you able to track that here in Pennsylvania, and is that of any concern of you? People just getting half vaccinated and then calling it quits?
We haven't seen that. I certainly intend to get my second dose on May 17th. The only concern I think we have is one of the things we'd like to do is really focus on students and universities. And as we get closer to summer break, it might be that the second dose is something that some of the students who are going to school in Pennsylvania will need to get the second dose somewhere other than where they got the first dose. So, but other than that, I'm not aware of any big, am I missing anything? So I don't know of any concern there. Any other questions? Okay, well, listen, thank you. Is that everybody? Did I get? Okay, thank you very much. And again, thank you for everything that you're doing. Thank you very much. Here.